Hello, and welcome to the AHAM CRCS exam preparation webinar. This is going to be a four-part series where we walk through all of the information that you will need to know to successfully pass the CRCS exam. Joining me today is Marina Himes, and my name is Andy Politz. We will be walking through all the information that is going to be outlined through the exam so you can help study and be successful in obtaining your certification. All right. The exam has three official sections: billing, credit and collections, and patient access front office. There is, however, a section called federal regulations and agencies. And this will also need to be known, although it doesn't get quite as much recognition as the others. So really everything that's in your study manual that's listed out, you're going to have to know. As we said, there are three official sections, but that federal agencies and regulations, they can pop up anywhere on the exam. They relate to all sections. And the test itself being made of 120 questions, 40 multiple choice kind of for each section, but it is all mixed in together. You're not going to take a billing section, then a credit section. You're going to have every section mixed in. So you'll need to be aware that you could see questions in any order, and they might not be popping up as you practice them through your manual. Right. You have to get a score of 70% in each section to pass the exam, and you have to pass all three sections. There is an option for retakes. So if you pass two sections but fail the third, you can do a retake of only that one section, but it has to be done within 12 months of the initial exam period. Okay. Your best and first resource for passing the exam is going to be the exam study manual. This is available through the AHAM website, and this is your key to success. Everything that is going to be on the exam is in that study manual. So this is going to be where you go to for getting the objectives of what you need to know, for learning the knowledge that you need to have, for testing yourself. All of this is going to be done through that exam manual. There's knowledge checks for each section that will ask information similar to what is provided on the exam. There is a glossary at the end that is great for definitions and acronyms. Definitions and acronyms are going to show up all over the exam. So having these available to you and studying those, especially through a glossary where it's a bunch of condensed information in one place, will be very helpful. The study manual is also going to help you out a little bit by telling you what you need to know. If you see something that pops up as a tip or has a little light bulb around it, or is notated in bold or otherwise brought special attention to, that's something you're going to want to know. So again, reading the manual cover to cover at least once, and then taking advantage of all the different materials and practice questions inside of it is going to help you to be very successful while taking this exam. Aside from using the exam study manual, there are some other resources we would like to recommend. First one, flashcards. When taking my certifications, I had hundreds of flashcards that I would go through repeatedly. I have relatives that won't talk to me anymore because I've asked them to grill me through flashcards so many times. And I did old school paper with those. If you want to get a little more technologically advanced, there's actually some online websites now that you can use to create your own quizzes and review games and flashcards. So that's something you can go online. You can create that. You can pull it up on your phone, on your computer, and make games and not have to carry around a big block of paper like I did. But those are also available for you as well. One thing I want to caution about that is some of these websites allow you to view other people's cards and other materials placed on there. And some of them do have CRCS materials on there as well. Just be careful that these can be submitted by anybody and aren't necessarily reviewed or approved by AHAM. So be very careful studying somebody else's information, as it may not be correct or up to date. And finally, one of our last recommendations is, if you can, try to engage with a buddy or with a group. It's a lot easier when you have people working towards one goal and you're working together to go ahead and try to learn all this information, quiz each other on it, and practice and understand what needs to be worked on. That does make a difference from what we've seen. A lot of the groups that we've had have been very successful when they keep each other honest to their study schedules. So if you get the opportunity and you have a buddy or a group that you can engage with, that is highly recommended. And in addition to the study manual, AHAM does offer different coaching kits. You can see we've included on the screen here the AHAM website, and there's actually a certification tab that has some resources that you can go through and review. So just keep in mind these little tips as we're going through the exam here. This is all resources that are available that you can check out, and we'll provide a few more along the way, but these are things to keep in mind as we get started. All right, the first section we're going to review today is kind of our unofficial section, the federal agencies and regulations. And to help walk us through this, I'm going to turn things over to Marina. So Marina, whenever you're ready.
Hello, everyone. Thank you for joining us for our first part of our 4-part series for the CRCS study guide. Like Andy said, we're going to go through the agencies and regulations, and then we will follow up with the next parts. So first up are the federal agencies and regulations objectives, which are listed in the study guide. These are kind of the main points that you will need to know and keep an eye out for when studying the manual. So be able to list the federal agencies playing a major role in healthcare and healthcare change, DHS, its operating divisions, and the OIG. Be also able to describe the role of CMS and OIG. As Andy mentioned, there are several acronyms within the book, so make sure you are aware of these. Name major federal regulations affecting healthcare and describe their impact, and describe the role of the Joint Commission. So the two main governing bodies impacting healthcare is CMS, which is the Center for Medicare and Medicaid Services, and then the OIG, which is the Office of Inspector General, And then the HHS Operating Division is the principal agency for protecting the health of all Americans and providing essential human services. There are 11 operating divisions of the HHS. Please be familiar with all of these, including the acronyms, as they may be listed throughout the exam. One of the main agencies is CMS, which is, as we are now, Center for Medicare and Medicaid Services. Medicare is listed as Title 18, and Medicaid is listed as Title 19. CMS is responsible for developing rules and regulations that govern Medicare and Medicaid. It also contracts with entities that administer Medicare benefits in various regions of the country. CMS administers the Quality Improvement Organization program to monitor and improve utilization and quality of care for Medicare beneficiaries. The QIO, which is Quality Improvement Organization, reviews all written qualified service complaints to determine the standard of care given, as well as the appropriate services rendered. The results of these reviews are submitted to CMS. We also have OIG, which is the Office of Inspector General. The mission of the OIG is to protect the integrity of HHS programs and the health and welfare of the beneficiaries of those programs. The OIG also has a major role in investigating fraud and abuse. In addition to the agencies, there are numerous federal laws and regulations that come into play due to the healthcare being a highly regulated industry. Some of these regulations are, or the areas are, patient rights, administrative simplification, affordable care, anti-fraud and abuse, telephone consumer protection, credit and collections, patient anti-dumping, and performance improvement. The first one we're going to look at is patient rights. So under the patient rights, there is a patient care partnership. The Patient's Bill of Rights was created in the 1970s by the American Hospital Association that stated expectations that patients and their families can have say about how they will be treated in healthcare situations. The Bill of Rights was replaced with a brochure titled the Patient Care Partnership. According to the brochure, during a hospital stay, a patient can expect high-quality hospital care, clean and safe environment, involvement in their care, protection of their privacy, help when leaving the hospital, and help with their billing claims. Two aspects of patient rights include the right to privacy and security of health information and the right to participate in their treatment decisions. First, we will look at the right to privacy and security health information. Due to the concern of the safety of the internet and other forms of electronic information exchange, HHS issued the privacy and security rules as part of HIPAA. The HIPAA privacy rule created national standards to protect individuals' medical records and other personal health information. The standards for safe and accurate information exchange are give patients more control over their health information, set boundaries on the use and release of health records, establishes appropriate safeguards that healthcare providers and others must achieve to protect the privacy of health information, holds violators accountable with civil and criminal penalties that can be imposed if they violate patients' privacy rights, and strikes a balance when public responsibility supports disclosure of some forms of data and protect public health. In addition to that, patients can make informed decisions when seeking care and reimbursement for care based on use of their information, how patient information is being used, and about disclosures, limits the release of information to a minimum, gives patients the right to examine and obtain a copy of their own records, and empowers individuals to control their health care. The national standards benefits patients as well. They can make informed decisions when seeking their care. One aspect of the right or the patient's rights is PHI. The PHI is protected health information, which is individually identifiable patient information. This includes any data that can be used individually or in combination to match patients with medical information. Several of the items listed are examples of PHI. There are more in the study guide. Be sure to understand what PHI is and how it can identify the patient in conjunction with the medical record. The administrative simplification rule has had an impact on healthcare, causing providers for more standardized information and electronic remittance device, which is part of using PHI. However, some payers have not standardized their information requirements and often ask for non-standard information in situational fields. Next, we'll look at the right to participate in treatment decisions. So the Patient Self-Determination Act was passed to ensure that patients understand their rights to participate in decisions about their own health care and to provide a means to ensure it. The Act deals with advance directives, which are written statements of a patient's wishes regarding medical treatment in the event that he or she becomes unable to make certain decisions. There are several types of advance directives. The first is a living will, which is a document that specifies what treatments a patient does or does not wish to receive. Decisions about future care can be made while the patient is alert. Patients can choose the circumstances under which they will die, and patients' desires regarding organ donation are made known. The next is a healthcare power of attorney or a durable power of attorney for healthcare. This is a document that designates someone else, as in a healthcare surrogate, agent, or proxy, to make decisions on the patient's behalf or if he or she is unable to do so. And the final is a DNR, which is a do not resuscitate order. This is a document that states that the patient does not wish to have CPR or similar interventions performed in the event of a medical emergency. Next is the Affordable Care Act, which is the Patient Protection and Affordable Care Act, also known as the Affordable Care Act, along with the Healthcare and Education Reconciliation Act, represent the most significant regulatory overhaul of the U.S. healthcare system since the passage of Medicare and Medicaid. The main goals of the Affordable Care Act is to decrease the number of uninsured Americans and reducing the overall cost of healthcare. It provides a number of mechanisms, including mandates, subsidies, and tax credits to employers and individuals in order to increase the coverage rate. The ACA requires insurance companies to cover all applicants and offer the same rates regardless of pre-existing conditions or gender. Next, we are going to look at fraud and abuse and the credit and collections regulations, and Andy is going to discuss those with you.
Okay. All right. So fraud and abuse. A couple definitions we're going to start out with here. Again, these are things that you can look up in the glossary of your book if you want to get something real quick, and these would make excellent flashcards as well. But fraud is defined as the intentional or illegal deception or misrepresentation made for the purpose of personal gain or to harm or manipulate another person or organization. This includes incorrect reporting of diagnosis and procedure codes, billing for services not furnished, altering claims to receive payment, accepting kickbacks, the routine waiver of deductible and coinsurance amounts, and things of that nature. Okay. Abuse is incidents or practices of healthcare workers that, although not usually considered fraudulent, are inconsistent with accepted sound practices, excessive or unwarranted use of technology, pharmaceuticals, and services. And these definitions go on for a bit. But this is something that you're going to want to know. There's always usually questions about fraud and abuse. And given the current environment and what we have to deal with in the healthcare industry, it's things that are rightfully included on the exam. Okay. All right, we're going to talk a little bit about the False Claims Act, and that prohibits making a false record or statement to get a false or fraudulent claim paid by the government. So if you're trying to come up with ways to remember that, it's almost self-explanatory if you read the definition. So that's a way to keep those in mind. There's going to be a lot of different acts, a lot of regulations. So trying to find any ways to link that information together is going to be very helpful. Okay. And administrative sanctions can be placed on there if CMS does identify any inappropriate or fraudulent behavior. And some of these can include denial or revocation of the provider number of application, suspension of provider payments, or application of civil monetary penalties, or CMPs. So again, another acronym to add to your flashcard deck there. All right. And the next regulations we're going to talk about now are actually pretty specific to the credit and collections section, but we're still going to review them here today. So we're going to go over the Telephone Consumer Protection Act, the Truth in Lending Act, Fair Credit Billing Act, Fair Credit Reporting Act, and the Equal Credit Opportunity Act. All right, and here's actually the Fair Debt Collection Practices Act. So this act, it's the result of debt collectors using abusive practices. In healthcare, collections is a regular part of what we do. So we have to be very aware of what this act is mandating to make sure that we're in compliance. So it prohibits abuse as well as the use of misleading information while collecting a debt. There's a few things that it specifies under here. The person collecting the debt cannot contact the debtor at unusual times. That's defined before 8 a.m. and after 9 p.m. Or at a place or time that is inconvenient to the consumer. If the collector knows that the debtor has an attorney, contact must be made with the attorney unless it's specifically stated and consent is given for the consumer to be contacted directly. And again, if the collector knows that the debtor's employer prohibits such calls, the collector is prohibited from contacting the debtor while at their place of employment. So again, things that are important to know, whether you are performing in-house collections or actually if you're outsourcing any of this, to make sure that anybody representing you is also abiding by this act and is in compliance. Okay, another act we're going to take a look at is Patient Anti-Dumping Act. And this is actually known as the Emergency Medical Treatment and Active Labor Act, EMTALA. Okay, this was enacted because hospitals were refusing to treat patients without insurance and sometimes transferring them to other facilities. They could be left there and notification not being sent to other hospitals, and it was creating an issue. So EMTALA actually requires that a medical screening and examination be completed. It requires stabilizing treatment, and it restricts transfers until stabilization. Registration staff is allowed to gather demographic information from a patient seeking treatment, but questions about how the patient is going to pay is prohibited until there has been a screening exam. All right, now the Clinical Laboratory Improvement Amendment, CLIA, yet another acronym. So this requires that all clinical laboratory services furnished to a Medicare beneficiary must be performed by a provider who has a CLIA certificate. All qualifying providers of lab services are issued a CLIA number, which should be reported on any claims. And a note about this, a state can become exempt from the CLIA status if its own legal requirements are equal to or more stringent than the CLIA's statutory and regulatory requirements. And if there might be a question about this, but right now, as of this recording, there are only 2 states that qualify for that, and that is New York and Washington. Okay, and lastly here in our federal agencies and regulations section, we have the Joint Commission. The Joint Commission, it's a private agency that protects and improves the quality of and safety of care. CMS allows the Joint Commission to give accreditation to hospitals. It goes through, inspects hospitals and facilities, and provides education on issues that can impact patient care and safety. It has many standards meant to protect quality and safety. Not all hospitals are accredited by the Joint Commission. Some are actually accredited by their own states or other agencies. And here's some numbers here that you might need to know. The Joint Commission will conduct an audit of a hospital every 39 months and of a lab every 2 years. The organization can audit a healthcare facility without advance notice, and that can be done as early as 9 to 30 months after its initial audit. The patient access section can actually expect Joint Commission surveys in the areas listed below, including distribution and discussion about advanced directives, patient rights and responsibilities, organizational ethics, the continuum of care, management of environment of care, confidentiality, privacy, security, and communication. These are elements that you're going to want to know about the Joint Commission. All right. Well, that is going to be everything for part 1 of our CRCS exam webinar today. So thank you very much for joining us. Thank you for taking the first steps on the road to certification and increasing your knowledge of the revenue cycle. I hope that you'll join us next time when we're going to be looking at part 2 of our certification webinar, which will be focusing on the billing section. So on behalf of Marina Himes and myself, thank you very much, and we will talk to you next time.